Namaskar. Welcome to my YouTube channel. Today we are going to discuss about Wbhrb Staff Nurse Grade 2 2025 CBT based question answer Part 25. Let's start. The first question: what is the most common site of fertilization? Option A, ampulla of fallopian tube. Option B, cervix. Option C, uterine fundus. Option D, isthmus of fallopian tube. The correct option is option A, ampulla of fallopian tube. Colorblind and hemophilia diseases of human being are due to option A, recessive genes present on X chromosome. Option B, dominant genes present on Y chromosome. Option C, dominant genes present on X chromosome. Option D, recessive genes present on Y chromosome. The correct option is option A, recessive genes present on X chromosome. Birth weight quadruple by option A 5 months, option B 1 year, option C 18 months, option D 2 years. The correct option is option D 2 years. Diabetic ketoacidosis DKA is characterized by option A hypoglycemia, dehydration, Kussmaul's respiration, option B hyperglycemia, dehydration, Kussmaul's respiration, option C hyperglycemia, edema, Kine-Stokes respirations, option D none of the above. The correct option is option B hyperglycemia, dehydration, Kussmaul's respirations. A nosocomial infection is defined as option A vital infection, option B a fungal infection, option C an infection acquired in a hospital, option D a community acquired infection. The correct option is option C, an infection acquired in a hospital. Nurse working in an ICU must be aware of the ratio of chest compression to ventilation in CPR procedure is option A 12:1, option B 30:2, option C 15:1, option D 16:2. The correct option is option B 30:2. How much oxygen a nurse should give to a patient with chronic respiratory failure? Option A 1 liter per minute with nasal prongs. Option B 2 liters per minute with nasal mask. Option C 10 liters per minute with nasal mask. Option D 12 liters per minute with nasal prongs. The correct option is option B 2 liters per minute with nasal mask. How long should a nurse wait after taking cold milk for recording oral temperature? Option A 5 to 10 minutes. Option B 10 to 20 minutes. Option C 20 to 30 minutes. Option D 30 to 40 minutes. The correct option is option C 20 to 30 minutes. All the factors aid in venous return to the heart except option A negative interthoracic pressure, option B one-way valves in the veins, option C left ventricular contraction, option D squeezing action of major muscles. The correct option is option C left ventricular contraction. Meaning of Barrett's esophagus is option A lower esophagus lined by columnar epithelium, option B upper esophagus lined by columnar epithelium, option C lower esophagus lined by cuboidal epithelium, option D upper esophagus lined by cuboidal epithelium. The correct option is option A lower esophagus lined by columnar epithelium. Gray-Turner sign is seen in option A myocarditis, option B pleural effusion, option C pancreatitis, option D Monteggia fracture. The correct option is option C pancreatitis. Systemic lupus erythematosus SLE affects option A connective tissue, option B liver, option C retina, option D none of the above. The correct option is option A connective tissue. Chest tube inserted into second and third intercostal space is suggestive of option A pneumothorax, option B pyothorax, option C Emphysema. Option D, pneumothorax. The correct option is option D, pneumothorax. Rheumatic heart disease is caused by option A, group A beta hemolytic staphylococci, option B, group A beta hemolytic streptococci, option C, pneumococci, option D, meningococci. The correct option is option B, group A beta hemolytic streptococci. Common clinical feature of renal carcinoma is option A, dysuria, option B, urgency, option C, painless hematuria, option D, erythema. The correct option is option C, painless hematuria. At term, approximate placental weight is option A, 300 gram, option B, 500 gram, option C, 700 gram, option D, 900 gram. The correct option is option B, 500 gram. Polyhydramnios means amniotic fluid volume more than option A, 1000 ml, option B, 1500 ml, option C, 2500 ml, option D, 2000 ml. The correct option is option D, 2000 ml. The most common cause of PPH is option A, atonic uterus, option B, retained placenta, option C, trauma, option D, blood coagulopathy. The correct option is option A, atonic uterus. Explosion of cervical mucus with blood is known as option A, lochia, option B, hemorrhage, option C, show, option D, discharge. The correct option is option C, show. Which of the following milestone is a red flag sign in child development if not attained? Option A, walking at 12 months. Option B, talking single word at 12 months. Option C, social smile at 3 months. Option D, vocalization at 2 months. The correct option is option C, social smile at 3 months. In breech presentation, denominator is option A, sacrum, option B, shoulder, option C, femur, option D, leg. The correct option is option A, sacrum. Growth chart is known as option A, New Barrett scale, option D, Road to Health chart, option C, APGAR score, option D, GCS score. The correct option is option B, Road to Health chart. What is nurse's primary critical observation when performing an assessment of determining an APGAR score? Option A, heart rate, option B, presence of meconium, option C, respiratory rate, option D, evolution of Moro reflex. The correct option is option A, heart rate. An infant is born precipitously outside the labor room. What should the nurse do first? Option A, tie and cut the umbilical cord. Option B, establish an airway for the newborn. Option C, ascertain the condition of the uterine fundus. Option D, arrange transport for the mother and infant to the birthing unit. The correct option is option B, establish an airway for the newborn. Small for gestational age and large for gestational age, infants have polycythemia because of option A, hypothermia, option B, hypocalcemia, option C, hypoxia, option D, hypoglycemia. The correct option is option C, hypoxia. Key feature of kangaroo mother care are all of the following except option A, skin to skin contact between mother and baby, option B, exclusive breastfeeding, option C, initiated in a facility and continued at home, option D, done only for babies with sinuses. The correct option is option D, done only for babies with sinuses. Strawberry tongue is seen in option A, Kawasaki disease, option B, Wegener's granulomatosis, option C, MPA, option D, PAN. The correct option is option A, Kawasaki disease. The term cephalocaudal means option A, infancy to adolescence, option B, head to tail, option C, simple to complex, option D, center to midline. The correct option is option B, head to tail. The pacemaker of heart is option A, vagus nerve, option B, atrioventricular node, option C, atrioventricular bundle, option D, sinoatrial node. The correct option is option D, sinoatrial node. The other name of body mass index is option A, standard index, option B, quartilate index, option C, calorie index, option D, citation index. The correct option is option B, quartilate index. Leprosy is also known as option A, Darier's disease, option B, psoriasis, option C, scabies, option D, Hansen's disease. The correct option is option D, Hansen's disease. First pair of teeth to erupt in children is option A, molars, option B, incisors, option C, canyons, option D, cuspids. The correct option is option B, incisors. Calcium level in blood is regulated by option A, somatostatin, option B, aldosterone, option C, thyrocalcitonin, option D, thyroxine. The correct option is option C, thyrocalcitonin. Which of the following is not a steroid hormone? Option A, thyroxine, option B, aldosterone, option C, estrogen, option D, more than one of the above, option E, none of the above. The correct option is option A, thyroxine. Killed inactivated vaccines are administered by option A, IV or IM, option B, subcutaneously or intramuscularly, option C, hypodermal, option D, none of the above. The correct option is option B, subcutaneously or intramuscularly. Major immunoglobulin of serum, option A, IgA, option B, IgI, option C, IgG, option D, IgM. The correct option is option C, IgG. Gender, age class, religion, type of disease and blood group are measured on option A, nominal scale of measurement, option B, ordinal scale of measurement, option C, interval scale of measurement, option D, ratio scale of measurement. The correct option is option A, nominal scale of measurement. The primary purpose of a code of ethics in nursing is to option A, increase hospital revenue, option B, ensure patient safety and uphold professional standards, option C, reduce workload for nurses, option D, favor the hospital administration. The correct option is option B, ensure patient safety and uphold professional standards. Prevalence refers to option A, new cases in a population, option B, old cases only, option C, all existing cases at a given time, option D, death rate. The correct option is option C, all existing cases at a given time. The ideal temperature for cold application is option A, 25 degrees Celsius, option B, 30 degrees Celsius, option C, 40 degrees Celsius, option D, 15 to 18 degrees Celsius. The correct option is option D, 15 to 18 degrees Celsius. Pernicious anemia is caused by deficiency of option A, thiamine, option B, iron, option C, vitamin B12, option D, folic acid. The correct option is option C, vitamin B12. The basic unit of healthcare delivery in rural India is option A, sub-center, option B, district hospital, option C, CHC, option D, PHC. The correct option is option A, sub-center. Before administering IV potassium, the nurse must ensure option A, patient is NPO, option B, potassium is diluted, option C, potassium is given IV push, option D, patient has low blood pressure. The correct option is option B, potassium is dilated. A nurse should check the radial pulse for at least Option A 15 seconds. Option B 90 seconds. Option C 60 seconds. Option D 10 seconds. The correct option is option C 60 seconds. The most common complications of myocardial infarction is option A heart failure, option B arrhythmia, option C stroke, option D none of the above. The correct option is option B arrhythmia. The normal range of intracranial pressure ICP in adults is option A 7 to 15 mm Hg, option B 20 to 30 mm Hg, option C 50 to 70 mm Hg, option D 0 to 5 mm Hg. The correct option is option A 7 to 15 mm Hg. The antidote for heparin overdose is option A vitamin K, option B protamine sulfate, option C calcium gluconate, option D atropine sulfate. The correct option is option B protamine sulfate. Drug of choice for eclampsia management is option A diazepam, option B phenytoin, option C magnesium sulfate, option D sodium valproate. The correct option is option C magnesium sulfate. Which of the following is a danger sign in pregnancy? Option A mild backache, option B light spotting, option C blurred vision, option D nausea. The correct option is option C blurred vision. The legal document that records a patient's care is the option A cardex, option B nurse's note, option C patient chart or medical record, option D doctor's order sheet. The correct option is option C patient chart or medical record. Thank you for watching. Please like and subscribe.